Hello everyone. Today we live in a community where the public keeps many stigmatic thoughts and negative views on mental health and mental health disorders. We are trying to seek out some of the common questions that are raised by the public in today's society. So today we have Dr. Shijo John, consultant psychiatrist at Marsliva Medicity, Pale. Welcome, doctor.
Thank you.
What are the common myths with regards to mental health illnesses?
There are a lot of myths with regards to mental health illnesses, not only today, but since several centuries. Some of the examples that I can tell you are, there is a myth that mental health illnesses are not real or mental health illnesses are not curable. In fact, all these illnesses related to mental health are to do with certain biological changes in our brain and body. It can be due to many other causes like stress, it can be due to environmental causes, it can be due to genetic causes. So mental health illnesses, like any other medical illness, is real and they are curable, but it depends on the type of illness how it can be cured. Another common myth is people with mental health illnesses are weak than general population, or they do not have enough willpower. It has nothing to do with any kind of weakness or any kind of problem in their character or any kind of reduction in their decreased willpower. It's basically again to do with changes that's happening in our brain, in our body, and like I mentioned, many other factors can lead to mental health issues. Also, there is a myth that once you start taking medicines, then you have to take it for lifelong. Well, it's not true with all the cases. There are few severe mental health problems where you might have to take it for lifelong, but in many other cases, you can start on a medicine, become all right, and then stop the medicine after a course is completed. Several other myths amongst us are like people with mental health illnesses are dangerous. In fact, studies have found out that people with mental health illnesses, and if you compare with the general public, they are usually having the same amount of violence. And in fact, people with mental health illness are victims for violence at many times compared to normal people.
So doctor, why is there a lot of stigma around mental health?
See, stigma is something that has always been part of mental health illnesses. Since several centuries, mental health illnesses have faced such stigma. It could be probably because of the lack of awareness, it could be the lack of knowledge amongst people, then it could also be the perception of people in general, the stereotypy that they have towards people with mental health issues, even if it is in the most mildest form. And stigma can be of many types. There are broadly two types of stigma. One is called enacted stigma or external stigma, in which a patient feels that people are treating him or her unfair. That is, others see that person as a different kind of a person or discriminates that person. Another type of stigma is internal stigma, where the patient himself or herself feels discriminated because he is having an issue, and because of that he feels stigmatic about the mental health issue.
So doctor, how are such disorders usually treated?
See, there are so many types of mental health illnesses. Broadly we say neurotic and psychotic types. Depends on the type of illness, depends on the severity of the illness, depends on the age group of the patient, depends on the medical comorbidities that he or she is having. Usually treatment is of two types. It can be of pharmacological type, or it can be by the help of non-pharmacological treatments like therapy. Depends on what kind of illness it is. For some illnesses, only pharmacology may be enough. For some illnesses, you need a combination of both therapy as well as pharmacology. So it depends on the type of illness.
If medication is required, how long does the patient have to take the medication for? Doctor, I have heard that many patients have been on an antidepressant for several long years, some even more than 20 years. Do all patients have to take medication for this long?
Depends on the type of illness again. If it is, for example, a case of major depressive disorder, usually medicines are given for 6 to 9 months and then they are slowly tapered and stopped based on the improvement and the recovery of the patient. Yes, there are some disorders where medicines have to be given for lifelong, like in case of schizophrenia. So maybe that is where you heard that patients are on medicine for over 20 years. Yes, there are a few times when even antidepressants have been continued for several years, and that depends on the type of presentation of the patient, probably a recurrent disorder.
Doctor, what is the general time frame in which most patients see results?
In case of depression and anxiety disorders, usually once the medications are started, results start coming in within a period of around 2 weeks to 3 weeks. Sometimes it can be a little longer than that. In case of psychotic disorders, for acute psychosis, patients we can see results in the patient even within within a week. In case of other disorders like schizophrenia and schizophrenia and related illnesses, we see results if the medication is working at all by around 1 month to 1.5 months. And it's not necessary that all the symptoms are cured by then, but there will be a definite effect of the medicine that is visible within 1 to 1.5 months in case of schizophrenia. For certain disorders like OCD, it could take even longer. It might take even 1 to 2 months for the effects of the medicine to kick in, and maybe the dosages of the medicine have to be optimized.
Doctor, for the past 2 years, we are passing through the COVID pandemic. So, has this pandemic affected the mental health of people?
Yes, of course, the pandemic has affected mental health of people in many ways. For example, people who have had COVID infection, they themselves have had anxiety, depression, insomnia, and many other problems. Depressive disorders have been found to be present in around 20 to 30% of people who have had infections. Similarly, anxiety disorders have also been found to be there around 30 to 40% of people who had the infection. At the same time, many people have had a lot of losses in terms of losing their family members, losing their friends, also in many cases losing employment because of the lack of opportunities. And in case of old age persons who were away from their family members and could not meet their loved ones, they also suffered from a lot of burden in terms of mental health. They had been going through phases of isolation because of restrictions that were going on. School children also have had a lot of problems, even though now it's a good news that schools have reopened. Many children have come to us with problems in many parents have brought their children to us with problems in their sleep patterns, in their eating patterns. Also, children who were suffering from anxiety related illnesses. So definitely COVID-19 has had an impact on mental health, and this was something serious which is still being taken care of.
Can mental health disorders be of heredity or genetic causes?
Yes, it cannot be just because of genetic cause. Genetic or hereditary cause may be one of the many reasons for a mental health issue. Most of the mental health illnesses are disorders which are caused due to multiple factors. It can be genetic, it can be to do with circuits and chemical changes in the brain, it can be due to psychosocial stressors, environmental stressors, and it can be due to many hormonal changes that happen in the brain naturally also.
Today, we are seeing a rapid rise in the suicidal case in our community. So, doctor, can you put down your comments on this? Can this suicide be a mental health disorder?
Yes, suicide is a very alarming thing for us, especially in our state. Kerala is always in the top few when it comes to suicide in our country. Suicide itself is not a mental health disorder, but suicide is because of an underlying mental health illness most of the times. And it could be because of depression, it could be because of a personality issue, it could be also because of significant psychosocial stressors which have led to committing the act. And many a times we neglect the fact that this is a problem, and any small warning sign that is found by a parent or a teacher or a family member or any friend should be brought to notice, and if medical help is sought in the right time, then we can reduce the prevalence of suicide in our community.
Doctor, is depression common among children and adolescents?
Yes, depression is common among children and adolescents. In fact, many studies say that out of 100 school-going children, around 15 to 20% do suffer from clinical depression, especially at this point of time. And not necessary that it is identified, because the presentation may be different in children. So depression is definitely prevalent in children and adolescents, and it's also important to bring them to the hospital or to the nearest doctor for further assessment and treatment.
Doctor, as a concluding question, are there facilities to treat behavioral issues, anxiety, learning disabilities, and other mental health issues in children and adolescents at Marsaliva Medicity, Palai?
Yes, we do have a team comprising of psychiatrists, psychiatric social worker, and clinical psychologist, along with a dedicated child development center which has early interventionist, child psychologist, a remedial therapist, occupational therapist, and neurophysiotherapist, who will together definitely help in treating issues related to behavior, development, and learning related problems. And we welcome you all to our department and also the Child Development Center, who can definitely help any child or adolescent who is in need.
So, we thank you, Dr. Shijo John, for your valuable time and patience that you have shown for us. Thank you, Doctor.
Thank you.
Thank you.